Hi, my name's Howard. I'm one of the first-year UCSF Hematology and Oncology Fellows. So I did this project with my mentor, Melisa Wong. It's a project in geriatric oncology where we're looking at the association of frailty in patients with non-small cell lung cancer who are elderly, and the association with frailty with overall survival, as well as other quality of life outcomes, functional decline. So right now, we're really asking the question, can we better predict who's at risk of poor outcomes, whether that's survival or whether that's quality of life decline? Right now, the way that's done in the clinic is really using just a few factors. Clinicians look at things like patient's age, patient's performance status, and really those are kind of the main ways we look right now, and it's kind of an imperfect test. And so what we were doing was trying to ask, is there a way to better quantify or better characterize people's risk factors for declining in this thing we call frailty, and how do we quantify that? So we were looking at a patient population that was 65 or older. We know that older patients are more at risk for having quality of life decline, as well as worse survival in cancer treatment. This frailty index has been shown in other cancer types to be able to predict when patients are more likely to have quality of life decline or to have worse survival. This is in other cancers like GI cancer, breast cancer, but we were looking specifically in patients with lung cancer, especially because they're getting multiple types of treatments: chemotherapy, immunotherapy, and targeted therapy. And so what we did was, in this population at UCSF that was between the VA, the Cancer Center, as well as SF General, we took patients who were already getting geriatric assessments as part of a cohort study looking at patients' quality of life with lung cancer treatments. We looked at their pre-treatment geriatric assessments, which basically looks at multiple domains of how they're doing in terms of things, not just age, not just performance status, but also cognition, their mood, their social connectedness, their nutrition. Have they fallen within the last 6 months? So really trying to take a more 360-degree view of a patient. And feeding that into this thing called a frailty index, which the way it's calculated is, for us, we had 47 items, 47 factors, like the ones I just mentioned. You can have a maximum of 47 in the denominator here, and the frailty index is essentially just how many of those risk factors do you have, and the sum of those over that 47 total possible. And then the fraction, if you have not that many, less than, the fraction is less than 0.2, you're considered robust, and the worse you get, you're considered more and more frail. And so we were looking at, does that associate with how long patients live, and then also how much quality of life or functional decline they have over the course of their treatment. And so what we found was that when you actually separate patients out, and this just shows you the population of patients we had, where there was 43% were robust, 38% were pre-frail, 19% were frail by this frailty index, and then we looked at their survival. And what we saw was that the robust patients tended to live much longer than patients who were either frail or pre-frail, here in the red and the orange. You see that this is a Kaplan-Meier curve just showing their survival over a number of years. And you see these curves really separate, where the patients in the red and the orange, the frail and pre-frail, have worse survival. Here, the median survival for frail patients was 5.6 months, pre-frail was 8.9 months, and then for robust patients, we actually hadn't even reached the median survival yet. And then looking at those other kind of quality of life metrics and how patients, whether or not they decline, we looked at whether they had more side effects, whether they had more unplanned hospitalizations, and whether they had more decline in their ability to perform instrumental activities of daily living. And what we found was that patients who were pre-frail or frail were more likely to have decline in their ability to perform instrumental activities of daily living. And so, what does this all tell us? This gives us a tool, this frailty index pre-treatment for patients who are getting treatment for non-small cell lung cancer, especially these more elderly patients. It gives us a tool to better predict who's frail and who might be more at risk for doing poorly with treatment, to give us the ability to give them better anticipatory guidance, to better tailor our supportive care measures, to connect them with the resources they're going to need to not only get through treatment, but also to just live their lives at home with the maximum quality of life they can.